Cancer is an illness that affects a lot of people around the world, and many doctors are always looking for different ways to cure cancer, or at least to find a cure. Joining us today is Dr. Jeff Yorio with Texas Oncology. Welcome to the show. Great to have you here, Doctor.
Thank you very much for having me.
Today we're talking specifically about immunotherapy, a new treatment for cancer. Explain that to me.
Sure. So, traditionally we've used a lot of other types of medicine, mainly chemotherapy, to attack these cancers, especially the more advanced cancers. And recently, over the last few years, there's been these newer drugs that have come out, these immunotherapy drugs. These are drugs that use the immune system to attack the cancer, so it's a different way to fight off these cancers.
Can you break that down for me?
Sure. So, what happens is in these cancers, they have ways to kind of hide from the immune system. They put on an invisible cloak or a coat, to disguise themselves from your immune system being able to fight off these cancers. And so these new drugs find ways to basically, remove that invisible cloak and allow the immune system to attack these cancers. And so, so if you think about immunotherapy, it's kind of like, the flu shot is a form of immunotherapy. We use a flu shot to get the immune system to recognize certain strains of the flu, and then you're able to fight off the flu if you're ever exposed. So it's kind of the same concept where we're trying to harness the immune system to be able to fight off the cancer, as opposed to using some of the other drugs we usually do.
You talk about other drugs. There are 3 new drugs that you're looking at right now?
Yeah, so over the last few years, there's been 3 new drugs approved, specifically for melanoma, and also now for lung cancer and for kidney cancer. And these drugs have been really exciting. So for melanoma, we've seen these amazing responses. So people that really didn't have a lot of good treatments before, now we can use these drugs to see amazing responses and potentially add years to people's lives, which has been a pretty neat thing. And because we're training the immune system to fight off the cancer, it seems to provide these really long responses, which is great.
You come face to face with these patients who are looking for a cure, are looking for a better way of life. My last question here is, what is it like? What's their response?
As far as response to these medicines,
their
or response
emotional
to
response,
Sure.
really, because this is an emotional issue for a lot of people and their families.
Yeah, and without a doubt. So I mean, it's nice to have other options for us to use for these patients. Now I think these type of drugs have provided some new hope for us. And for these patients,
for them.
Exactly, without a doubt. And so it gives us something to look forward and potential. And certainly it's not perfect, and we're not fixing everybody and curing everybody, but it's another step in the right direction. It gives us some more ways to fight off these cancers, which is great.
The right direction is what everybody's looking for.
Exactly.
All right.
And so very exciting. It's good times and new times in cancer therapy, and I think we'll continue to see improvements over the years. So it's good.
Dr. Jeff Yorio with Texas Oncology, thanks so much for joining us today.
Thank you very much for having me.